Good morning, everyone. My name is Laura Podolsky. I am Assistant Director of the UC Institute of Transportation Studies, and I'm so pleased all of you are able to join us for today's webinar on early insights from mobility wallet programs. Some of you may have noticed that we tweaked the title so slightly. One of our original speakers, Angela Sanguinetti with UC Davis, is unable to join us today, so we will be shifting a focus looking at one of the nation's largest mobility wallet programs underway right now in Los Angeles. So before we begin, I'd like to introduce the UC Institute of Transportation Studies. We are a community of faculty, professional researchers, students, and staff, all dedicated to advancing the state-of-the-art research that will inform transportation policy and practice in California and beyond. We were established by the state legislature in 1947. And there are 4 ITS branches in the UC system. So those are located at UC Berkeley, UC Davis, UCLA, and UC Irvine. I'd also like to acknowledge the support that we received from the state of California. So much of the research you're going to be hearing about today was supported through the Road Repair and Accountability Act of 2017, or Senate Bill 1. So we're very grateful to have that support. Now, just a little bit of housekeeping. This webinar is being recorded. We will post it on our website, and everyone will get a link to where it is posted in a follow-up email after today's webinar. You can also find it on our YouTube channel or just going to our event page on our website. There's also closed captioning. Just click on that CC button in your Zoom taskbar. And if you run into any issues, which we hope you don't, just let us know by pressing that Q&A button, describing your issue, and technical support will reach out so that you can, hopefully we can troubleshoot it, solve it, and that you can fully participate in today's webinar. Now, jumping into our program, I'm really excited to introduce our moderator today, my colleague, Molly Cohen-D'Agostino. She is the co-director of the Mobility Science Automation and Inclusion Center, or MOSAIC. So this is an exciting new initiative at UC Davis covering connected and automated vehicles, artificial intelligence, robotics, and related public policy strategies. She is also the policy lead for emerging transportation technologies at UC Institute of Transportation Studies. Her latest publications have examined automated vehicle policy, mobility data, equitable congestion pricing, and transit payment innovations. She received her master's in public policy from the Goldman School of Public Policy at UC Berkeley. So, Molly?
Thank you, Laura. Appreciate the introduction. And I'm so pleased to be moderating this webinar on universal basic mobility programs, and of course, with a focus on the work LA Metro is leading. I'll just do a quick overview to kick things off. We thought a high-level introduction to the subject of today's webinar would be helpful, so that we could hear, and then we'll hear some early insights from our LA Metro team, both from Avital Shavit with LA Metro, as well as researchers at UC Davis, Caroline Rodier representing, and Madeline Brosen from UCLA. And then we'll conclude with a Q&A, open, of course, to all of you. So we'll be prepared to answer some questions from our speakers. So with that, I'll turn over to some of our introductory slides. Next slide, please. Yeah, so we thought it would be helpful to ground this presentation in sort of the problem and some of the solutions that universal basic mobility and mobility wallets can address. This graphic is meant to represent transportation poverty, as some researchers call it. This actually is a slide that was created by Angela Sanguinetti's research team to describe the experiences of folks that are traveling, who are taking transportation options that are underfunded, unfunded, and sometimes do not meet their mobility needs adequately. And that, of course, long waits at transit stops or long distances to arrive at transit stops can make it really difficult. So next slide. A solution that has been proposed about 5 years ago is this concept of universal basic mobility. It calls upon government actors to ensure that all residents, regardless of their socioeconomic status and abilities, can access transportation services for basic needs like work, food, and healthcare. This is, let's advance to the next slide too. This concept is really catching like wildfire. We're seeing universal basic mobility programs and mobility wallets emerge in several cities, and we may not even have this list of the number of cities comprehensively here because we studied this a number of years ago. But where we've seen these efforts occurring, basically it's allowing communities to provide some financial resources to community members so that they can better meet their mobility needs and achieve that goal of basic mobility. So there, you'll see locations in Portland. Portland sort of, was first to spearhead this type of mobility wallet program. They have 3 different programs, one targeting downtown, one targeting affordable housing, and also some new residential development. There's also a small program in Sacramento that provides some resources to folks who need it to get around. Oakland had a short pilot, and Pittsburgh as well, as Stockton had a pilot as well. And also, of course, Los Angeles, which we're going to learn a lot more about today. So I'm going to turn it over to our panelists, but I wanted to first do some introductions. So we are aware of who is going to speak. So first I'll introduce, I'll do it backwards order. So I introduce Avital last, and because she's going to be speaking next. So first I'll introduce Madeline Brosen. She's the Deputy Director of the UCLA Lewis Center for Regional Policy Studies, and she manages the center's efforts to advance knowledge about housing affordability and transportation equity topics for Southern California region. Her research evaluates the effectiveness of interventions seeking to address transportation equity and improve people's quality of life. And she also has a master's degree in urban planning from UCLA and serves on the advisory board for Investing in Place, a nonprofit in the area. And Caroline Rodier is a researcher at the Institute of Transportation Studies at UC Davis. Her main research areas include transportation and environmental planning and analysis, and she's focused on greenhouse gas emissions and also equity. Most recently, she served as a key partner for the design, implementation, and research evaluation of pilots intended to reduce GHGs and address unmet travel needs of underserved communities in California's Central Valley and in Los Angeles. So a lot of really applied research happening from these accomplished women. Our next speaker is from LA Metro, Avital Shavit. She's the senior manager in the Office of Innovation, where she focuses on shaping policies and implementing projects that nudge LA County towards more sustainable modes of transportation instead of driving alone. She previously worked at LA Metro's planning department, where she had a lead role in the launch of Metro Bikeshare, and she's a daily transit and bike rider with a flair for cycle chic fashion. Avital also holds a master's degree in urban planning from UCLA. So we have a lot of UC alums and UC representation here. So I'll turn it over to Avital next. I'll just mention that, you'll find this out during the presentation, but we have had a great partnership with LA Metro and LA and the LA DOT on this mobility wallet project. And both UC Davis and UCLA have been research partners through the whole process. And I think that's been really amazing. So thank you so much, Avital, for that and for your remarks.
Sure. Hi, everyone. Avital Shavit. I'm a senior director at LA Metro. Thank you, UC ITS, for inviting me to this really cool collaboration of a brain trust about universal basic mobility. If we go to the next slide, I just want to give a little overview of what is a mobility wallet and what are we doing in Los Angeles County. In the last year, we've run what's a phase 1 of our mobility wallet pilot with 1,000 participants in South LA that received $150 a month for a year. Which ended actually as of the end of April, and they'll actually have a buffer to spend all the funds till August, and they can use those funds for 8 different types of shared transportation. And the way that we do that is the mobility wallet is a prepaid debit card and we load the money on a monthly basis. The money rolls over if people don't use it every month to the next month and through the program. They can use it on regular public transit, bus and rail. They can use it on commuter buses, commuter trains, like Greyhound, like Flixbus, Amtrak, Metrolink, which is our commuter rail in Los Angeles County. They can use it on car share. They can use it on car rental because car shares is in the same kind of banking bucket, merchant category code as car share. And the city of LA has a really robust Blue LA car share program that we've been partnering. And you can also use it at bike shops. So you can go and buy a bike, you can buy an e-bike, you can buy a helmet at a bike shop with this prepaid debit card. You can also use it on shared bikes and scooters. And so we've been working very close partnership with the city of Los Angeles. They, about 2 years ago, got a really generous grant from the state of California, from the California Air Resources Board, to fund a larger universal basic mobility pilot. And you'll see in the chat, there's a link to that website, ladot.lacity.gov/UBM, where you can find out more about that bigger kind of project the city is leading, which includes Mobility Wallet. Next slide. You can also see in the chat there's a source article about that has some data points that you'll see in this presentation about the Mobility Wallet in our work. We've been really lucky to connect with UCLA and UC Davis at the beginning of our work, probably a year and a half, maybe more ago, saying we want to do a pilot. We want this pilot to be really data driven. And we want to really measure the outcomes of the pilot using the best practice research methods, which as a planner who went to UCLA, I learned a little bit about, but I don't practice in my everyday work. And generally, applied planners, the standard practice is to evaluate projects after you do them. And what we wanted to do is really start at the beginning of the pilot and really build in kind of goals and measurements that we were going to work directly hand in hand. We have a monthly meeting with UCLA and UC Davis. Sometimes we talk to them more than that to figure out how do we implement kind of best practice research methods for this pilot. And then so, one of, I think, the key successes so far that I'm reporting out is like engage, practitioners should engage the universities in their backyard. Particularly, we're in California, we have such a wealth of universities and academic institutions that we can work with. Do it often and early so that you can engage them to set goals. And Caroline and Madeline will talk more about the goals that we set and how they're actually supporting the project to measure them as we go through. Next slide. And just some data points. This is actually data which UC Davis collected from beginning and midpoint surveys, and they're actually they're going to do an endpoint survey for our first phase. But we found a lot of people in the pilot, right? The 1,000 people in the initial phase, right? We were meeting kind of what we're hoping to get in terms of our target market. We have people who are low income and who are car light households or car zero households. 40% of the households in the pilot are car zero households. And 80% were car light households. And then 80% of them are also participating in financial assistance programs. And just in terms of anecdotal kind of stories, we heard from people, right, that they had a vehicle, but maybe they lost it because they got in a crash and they didn't have the financial resources to repair their car. And so this mobility wallet actually helped them get around on the bus and the train to access job opportunities, which is actually one of our goals. We had another individual be able to go to a local bike shop and buy a bike to get around for trips, but also for exercise. We also had another participant report that she is able to use it to get to the supermarket for trips that are difficult to take on transit. But she also uses it to pay for a taxi for her mother who works late night shifts at a laundromat. So this idea that the mobility wallet can use for a household is also really cool. Next slide. And in terms of what we're finding, our initial data, we get to see the purchases on the prepaid debit card. So we get some really rich data in terms of how people are spending the money that we're giving them every month. We found that we had this is actually only 11 months of data. We're just finishing analyzing our 12th month of data, but it's pretty robust. We're finding that a little over half of the trip purchases are spent on public transportation. But still, we're seeing a good amount of, about 40% of trip purchases are ride hailing trips, Uber and Lyft, and taxi, also access services. We're seeing about 2,000 trips via shared scooters and bikes, and 132 purchases at bike shops, which is a nice chunk. And next slide. And just some next steps of where we're at. One of the things that we kind of set out at the very beginning is to kind of take a phased approach. We did have a generous grant from the state of California through a partnership with the city of Los Angeles. We deliberately planned to split that out. We did 1,000 people in phase 1. We're going to do another 1,000 people in this phase 2 that's coming up this summer that we're actually going to be doing solicitation later this summer for. We also got additional funding, hopefully, if the state budget comes through, from SCAG to do county-wide mobility wallets. And so we're looking to have about 2,000 wallets given out to the community in phase 2. We're also worked with our partners at Caltrans to apply for an Attain grant, which we were awarded last year. And we will continue working with the UC partners to do research on, and that would be next year. And one of the questions is, how do you keep sustainable? How do you fund this program sustainably? It's a pilot. We're still evaluating it. We're still working with research partners, and that's really what we're here to discuss. Yeah, and I'll hand it over back to Molly.
Thank you so much. Yeah, really great to learn about LA Metro's work on this. Now we're going to turn it over to Caroline to add some of their data analysis to the mix.
Thank you. Yes, I'm Caroline Rodier, and I'm a researcher at UC Davis. And, I work with my team on this project, and it's been really a very exciting project, started early on and continued, and will continue to work on it. So it's been great. But today I'm presenting some early findings from the mobility wallet pilot in South Los Angeles. We'll go over the research design and a limited or at least one outcome that we're discussing today because of time constraints. So next slide, please. Okay. Oh, sorry. No, if you could go back to the previous one. Thank you. Okay, research design. Okay, next slide. Okay, this slide shows the quasi-experimental randomized control trial design for this study. Sometimes it's known as RCT. The study began by recruiting participants. LA Metro recruited participants online and in person. People were directed to go to the website that LA Metro developed to apply for the program. LA Metro staff then evaluated the applications, see whether people met the income requirements and lived in the South LA study area. And then we randomly assigned applicants to the treatment and control group. The treatment group included those who activated and used the mobility wallet, and the control group are a group of people who did not receive the the mobility wallet. And then the random assignment included a stratification by gender and students. You'll see a little bit later that those populations were overrepresented among applicants. Okay, next slide, please. Okay, just to give you a sense of the longitudinal timeline for survey implementation, the survey was implemented before people began or received the initial deposit for the mobility wallet in April of 2023. And then subsequently the next month, there was the mobility wallet deposit. About 6 months later, after people had used the program for a while, we implemented our midpoint survey. And then just last month, the final mobility wallet was made. We're implementing the final survey. And then we anticipate implementing the after survey in November of 2024. And we did have generous incentives for survey, for those who completed the survey, $25 per survey, plus an additional $25 incentive if you complete all the surveys, which is really important for our evaluation. Okay, next slide, please. Okay, now we're going to look at data, some of the data results. Okay, so this map shows the South LA study area where participants were required to reside. The table compares the distribution of population attributes for the treatment and control group to the census data for the study areas. The results show that the treatment and control groups include reasonably consistent distributions of household size income ranges within the household low income categories for pilot eligibility. So, you know, we had that cap on income by household size. And we have a somewhat higher share of Hispanics and Black or African American populations. However, again, we did find there are more zero vehicle households, more women, younger populations, and more students in our applicant pool. And as Avatal pointed out, you know, most related to zero vehicle households, a lot of people in the, a lot of the respondents are transit dependent. And then, you know, the yellow highlights really show the biggest differences. Okay, next slide, please. Okay, here, this next slide has survey responses and response rate relative to opt-ins. So before we implemented the survey, we sent people a request to opt in to take the survey. And you can see the opt-in numbers. About 25% of qualified invited participants opted into the survey. And when we do opt-ins, we basically at the university have Department of Human Subjects, and we have to follow their rules, and we have to inform participants that they, you know, basically have their rights before they fill out the survey. And about 65% of the treatment and 51% of the control opt-ins completed the midpoint survey. So those are basically our sample size for the treatment and control group, 215 for the treatment group and 115 for the control group. Unfortunately, we had a bit less for the control group. You know, it's a bit harder to keep people in the control group. Okay, next slide, please. Okay, initial results. So again, you know, I showed you that timeline, but really at this point we just have the midpoint survey results. So we're looking at the change from the baseline to the midpoint for both the treatment and control group. Okay, next slide. Okay, so today we're just focusing on transportation insecurity, which is, you know, kind of an overall way to look at the experience of limited access to essential destinations and opportunities. We have, as you could tell from Avatal's slide, many more outcome measures, but we haven't had a chance to evaluate all those yet. Okay, next slide. And we didn't have time to present it today. Okay. So what is transportation insecurity? That may be a new term for people, but it is the experience of being unable to travel to essential destinations and opportunities, which really are very important for social and economic mobility. The Poverty Solutions Group at the University of Michigan developed the first validated transportation security index. The index enables tests of transportation insecurity interventions, such as interventions like the South LA Mobility Wallet pilot. And so we use questions for this transportation insecurity index in our survey. Okay, next slide. Okay, so there are 16 questions included in our index. We selected 6 of the index questions. We want to keep the survey as kind of short as we can, given all the outcome measures we want to explore. But here are the 6 questions. They include, were you late getting somewhere because of problem with transportation? Did you have to arrive somewhere early and wait because of the schedule of the bus, train, and person giving you a ride? Did you have to reschedule an appointment because of a problem with transportation? Did you skip going somewhere because of a problem with transportation? Did you worry about whether or not you would be able to get somewhere because of a problem with transportation? Did you worry about inconveniencing, your friends, families, or neighbors because you needed help with transportation? Many of these questions were developed through ethnographic research using, qualitative measures. We were very excited to see these measures. They really resonated with a lot of the focus group research we've done with marginalized populations in California. Okay, next slide, please. Okay, we added 2 additional questions to the transportation index, which were related to the mobility wallet pilot. Was it difficult for you to afford the transportation options you wanted to use? And then we also added, how often do you feel unsafe while traveling? Again, there's research that shows this is, a major barrier for women using transit in California, and it also was part of our finding in our focus group research. Okay, next slide, please. Okay, we looked at a number of independent variables. There are about kind of 6 topics here that we felt could play a part in the effectiveness of the mobility wallet. So these included access to a personal vehicle. So household vehicle sufficiency. Is there 1 or more cars for every adult in the household? Do people have a driver's license? Ability to pay for transit or shared mobility. Do you have a credit card, or are you unbanked? Do you have a cell phone with internet? A lot of, most people have that now, but it would be a major barrier to using, for example, ride hailing. Transit payment card. LA Metro has their tap card for paying for transit. And then LA Metro has a range of discount services, for different populations that can be applied for. Physical abilities, limiting use of different modes. Did the participant have a disability? Did a household member have a disability? What are the assistive technology used? Age-related socioeconomic attributes such as activity-related socioeconomic attributes such as age, household size, and composition, children in household by age range, whether they're employed or a student, resource-related economic attributes such as income and financial assistance and education, And then other demographic attributes such as race and ethnicity, what their primary language is, if it's other than English, and location of the residents for census blocks to understand variation and accessibility within the study area. Okay, thank you. Can you go to the next slide? Oops, okay. Oops. Okay, there we go. So for the control group, so this is the average score for each transportation security index question. So for the control group, you can see that there's a very slight improvement in scores in the mood point compared to the baseline. And for the treatment group, the improvement seems to be more pronounced. So we ask people, these questions ask people, you know, over the last 30 days, how often you experience these challenges. So if someone said never, that indicates that they're transportation secure, somewhat to mixed, and then often would be they have a kind of a higher level of transportation insecurity. And then we average the scores over all the questions. So a higher score would be people would be more secure, a lower score, they're less secure. Okay, next slide, please. Okay, so difference in the transportation security score. So this figure kind of graphically illustrates the difference in approach that we use to analyze this outcome. And it measures the significant direction and magnitude of the treatment effect in the study. It shows the trend line before and after the intervention, baseline and midpoint. The green line is the control with results from the baseline and midpoint surveys. And the counterfactual for the treatment continues the baseline score to the midpoint. The approach assumes that this is what would have happened without the mobility wallet intervention. So, and then the difference between the counterfactual treatment and the treatment score measured in the midpoint survey is the mobility wallet intervention treatment effect. And so you can see that purple line that goes, that increases to the midpoint survey where we captured their score in November of 2023. Okay, next slide, please. Okay, so here is our mixed effect difference in difference model for the transportation index, the transportation security index score. Okay, so we estimated the model with and without the questions that we added to the University of Michigan's Transportation Security Index questions, you know, the two questions I mentioned before, and we didn't see any significant differences in the model. So these results include results for all 8 transportation security questions. So the mobility wallet intervention effect is on the 4th row under fixed effects. So, you know, we found that it is significant at the 0.001 level with a magnitude of plus 0.29 relative to the mobility wallet counterfactual. So that, again, that would be increasing the change from the baseline to the midpoint survey. It would be an increase of 0.29. So, and the underneath the time by intervention or the mobility wallet effect, we have variables that we included in the model and tested. So age played an important role in this analysis. Age can represent life cycle effects of changes in travel demand and increasing resources. People under 30 often include students who have limited disposable income and perhaps more varied and frequent destinations. Okay, individuals who have a disability or a family member with a disability experience lower levels of transport security compared to those without disabilities. Driving and taking fixed route transit can be challenging, and paratransit also involves long wait times and travel times. We also found that households with children under 5 relative to other households experience lower levels of transportation security. This may be due to challenges taking children on transit. For example, strollers and ride hailing requires child seats and other complexities that Madeline is going to explore in her presentation. So not surprisingly, vehicle sufficiency for households, again defined as 1 or more vehicles per adult household members, are more likely to have a higher TSI score compared to those who could be considered transport insecure. Okay, next slide, please. Okay, conclusions. So our preliminary analysis shows that the mobility wallet in South LA significantly reduces transport insecurity after only about 6 months of the program operation. Again, vehicle sufficiency, age, gender, children under 5 in the household, and possessing a cell phone with internet and a credit debit card are factors that may contribute to transport security. Okay, next slide. And I just want to acknowledge the UC Davis research team. So Brian Harold is a policy evaluation specialist at UC Davis, and he does the hard work of survey design and nurturing the data, ensuring that we have high response rates and kind of all things related to processing and summarizing the data. Yunwan Zhang is a PhD student who primarily does a statistical analysis work on the data set. Christiana Drake is a statistics professor at UC Davis who supervises our statistical work on this project. And Xiaowei Zheng and Jingji Sun are student assistants who support us with data analysis. Okay, well, thank you very much.
Thank you, Caroline. Okay, let's turn over to Madeline.
Great. Thank you all for joining our webinar today. As mentioned in the introduction, my name is Madeline Brosen. I'm the principal investigator for UCLA. And we're really fortunate to be joining what you can see is a really robust team of people that are implementing, evaluating, and actually working to make this program come to life. So in the UCLA research, we're focusing on the effects of households with children. Caroline kind of teed this up in her work a little bit, and I'll walk through what we're finding in our different methods. I'll just touch a little bit and add to what Molly mentioned about the concept of universal basic mobility, explain how we're doing our research methods and who's involved in our surveys, some of our mid-program findings, and next steps in the work. So as Molly mentioned, the idea of universal basic mobility is the concept that anyone should have the required transportation to meet the required resources to meet their basic transportation needs. Mobility wallets, which we're talking about today, is one of the tools that help to achieve this concept. And what we're seeing through all of these pilots that Molly described is UBM is really being operationalized really quickly. But the concept itself is a little bit less defined. And we hope throughout this work, we'll be able to actually kind of offer, even more robust and kind of better understanding of the concept itself. So the reason that we're really focusing this work on the effects on households with children is because we know that the literature indicates that there's a number kind of differences. If anyone on this call is a parent, this information is probably very, understanding, you're probably nodding along, that just children makes life more difficult, period. It's particularly true in terms of the complexity of how you get around. So there's work saying that it makes it more complex, that just cars end up working really well. And we'll come back to some of what we heard in the interviews relating to that. For women that have children, it ends up reducing the commute distances because you need to be able to, get your children around and don't want to be too far. And then especially if we kind of think about the context in which this program in South LA is being done, this complexity and difficulty is worsened by a number of different safety concerns in low-income neighborhoods, thinking about traffic crashes and traffic violence, elevated rates of violence and crime, and racially biased policing. What this all adds up to is that there ends up being these compounding challenges that not only show up in transportation, but that really show up in terms of the quality of life for low-income parents and their children. Children and parents end up just participating in fewer activities. They end up having different job prospects. That just kind of the connection between how you get around and what your life looks like ends up being really connected. And why we're really excited to work on this about the mobility wallet is that we know these disparities, but we have less evidence about what can work to address this. So we're really focusing on that topic here. So what we did is we developed an interview instrument. There was a semi-structured guide. It took about 30 to 40 minutes to go through each conversation. We then selected a stratified random sample of the mobility wallet participants that have opted into the research. I'll show you a little bit about the group in the next slide. We ended up doing phone interviews both before to grab a baseline and during, which is very aligned with the Davis process. And we conducted phone interviews with 36 participants. Each participant received $50 for each interview. We then created transcripts from each interview, created a code list, went through each one of those interviews with that codes, and that resulted in this thematic analysis to actually analyze the interview data. To give you a sense of the people that are in our sample, this is what I mentioned in terms of the stratified sample. So we wanted to create a group that both was relatively equal in terms of households that had households that had children in their household, and kind of what we're calling as car access. So we have these 4 groups that are in the top left corner. Car deficit is where households have fewer cars than adults. So we have, in terms of the households with kids, we have some that are car deficit and ones that are not. And then similarly, ones that don't have children in the household in that same stratification. I do want to say that there was a number of different ways that children could show up in the household. Not all of our interviewees are parents themselves. Sometimes the children in their household are their younger siblings or other family members that live with them. We have a relatively even distribution of men and women and a small sample of people that identify as non-binary. The vast majority of people are people of color, Latino, Black, Asian, American Pacific Islander. Some spread of education and employment, and kind of looking at household income. And I want to point out that we have 9 of our 36 are extremely low income. Having an income of less than $10,000 a year, living in a high cost region like Los Angeles, makes life very difficult. So now I'm going to tell you a little bit about what we're learning in our mid-program interviews and how it compares to what we heard at the baseline. So what we're finding is really one of the most interesting and I think new findings from this work is how the mobility wallet reduces both transportation and life stress. In the baseline interviews, we heard about people talking about stress in a number of different ways. It came from having to rely on other people. It came from safety concerns during their transit trips, the lack of financial resources for transportation, and just in their budget overall, that ability to really how to figure out how to make kind of the financial ends meet, and about having limited access to things like Lyft and Uber, which can help in particular situations, but because they were most so expensive, people would really reserve this for kind of emergency cases only. When we came back and ended up talking to people during the mid-program, we found a number of different ways that actually they're showing up reduce stress. So the one was that that they had options rather than being late for work. If they woke up late, if their bus didn't arrive, they could be able to call a taxi, an Uber, a Lyft, and not really stress about how you're actually show up to your job. They also talked about the ability to arrive early. to be able to have a meal at your job, or just really arrive in a way that you show up ready for work. So, for example, one of our interviewees talked about how he works with kids for his job. And when he didn't experience stress in his transportation journey to his job, he just felt more calm, more ready to kind of talk to his kids, and just felt like he was better at doing his job. People also experienced stress relief because they were able to engage in more social activities. They were able to visit friends and family. They were able to go out with friends. And that really, this just provides, this kind of overall concept of self-care, kind of things that really contribute beyond just these essentials like getting to work or getting to medical appointments. And because the program just provides money to low-income people, they were able to reduce their stress by having overall budget relief. They just had more money in their pockets. So some of the quotes that I think demonstrate what we are hearing from people, this top one is talking about how this person works really early in the morning. And if you need to get to work at 6 o'clock in the morning, you're traveling so early where you have relatively infrequent buses. So when she get in a situation where buses weren't running, or there was a bus run that was missed, she had the mobility wallet to bridge the gap to get to her job, and it reduced in lower levels of stress. The other thing is that people didn't have to worry about taking funds from their own account to be able to pay for transportation expenses to get to the doctor. And they were able to get to doctor's appointments and not worry about having to actually, have their personal funds depleting. The Avital mentioned about how 80% of the people that are receiving mobility wallets are receiving some type of financial assistance. In our sample, the majority of people, that financial assistance is in the form of public health insurance and Medi-Cal or Medicaid. And so the mobility wallet seems to be relatively complementary, so that not only you have public insurance, but you have the ability to actually pay to get to your appointments. Overall, what we think this speaks to is the mobility wallets are a tool for creating what we're calling kind of a transportation safety net. As you saw in Avital's slides, people are using their wallet on a number of different modes. They're taking trips by transit, by Lyft and Uber, by bicycle, by scooters, and they're having access to really a much more fuller suite of options. So here's a quote from one of our interviewees. She's a single woman. She was working in Malibu and had a car. And at some point during the program, her car went out. She actually had to completely switch jobs because there was no way that she could make it from South LA to Malibu in any reasonable amount of time. So she was talking about how, once she had this really unexpected change in her transportation, the mobility wallet helped to lower her level of stress. She ended up getting a new job, but she had the ability to actually pay for that. She actually described mobility wallet as a safety net because now that she had this transportation money, she had the ability to start saving up to be able to get her car fixed. And that's really a great opportunity for her to be able to bridge this point in time where she had this unexpected situation. I'll also say that a number of our interviewees received federal housing assistance in the form of a housing voucher. And, when people were between housing and had to look for housing, the ability to have the mobility wallet also helped them to actually get into that housing because they had a number of appointments. So in addition to just being able to get to the things they need to, the mobility wallet helps to bridge these unexpected moments in someone's life that are really inherently stressful and difficult. While we're finding really good results from this program, we think the effects are more measured for households with children. And Caroline kind of spoke to this because they're having kind of more transportation insecurity in the first place. So households with children end up having more complex travel at the baseline, spending a lot of time getting their kids to and from school, and they just had a lot more transportation needs. Larger households, primarily those with children, tended to deplete their funds before the end of the month, meaning that they, had weeks that they actually didn't have any mobility wallet money to be able to meet their needs. However, the budget savings did provide opportunities to spend money on their kids to get basic things like shoes and clothes that kids run out of a lot. So in summary, just want to highlight how the mobility wallet is a really new way that we're addressing transportation inequity. Mobility wallets allow people to have choice in the transportation support they need. And it's a demonstration of trust that people are the best arbiters of their life. And by giving them money, they can really use that as they see fit. Given that we've seen that larger households end up running out of their funds earlier, we think that future iterations in Los Angeles and other places should consider household size in setting that monthly amount to make sure that the funds can actually, help to alleviate concerns in larger and smaller households similarly. But overall, we think the preliminary results that we're seeing in UC Davis show how transportation support can improve people's quality of life. We think that there's great information just about the types of trips people are taking, how they're using a range of modes, how they're getting to more things. But transportation is a means to an end. It's really the idea of what you can get to and how that makes your life better. And we're starting to see how those outcomes are really important in terms of also measuring alongside traditional transportation measures. With that, I want to wrap up and thank the amazing team at UCLA that helped us get this done. Yesenia Barcena, Tamika Butler, Evelyn Blumenberg, Alejandro Rios Gutierrez, and Madeline Wander, and thank UCITS and the California Resilient and Innovative Mobility Initiative for funding this research. And with that, I think we'll have to take some time for questions.
Thank you so much, Madeline. Really just so exciting to see the impact that these programs can have on lives of Angelenos, and as we think about how to scale these programs on everyone. So I think my first question was and I'm just going to launch right into questions because we've just got 8 minutes. And I thank you so much for everyone who's asked questions on the chat or in the quick question and answer bucket. Please ask questions from here on out in that question and answer bucket, so we can just that's a button on the bottom of your Zoom panel. So we can make sure that we're answering them either live or by text. So our first question was for Avital to just speak to, to react to the presentations and also to speak to some of the challenges that these programs are facing. Although this was hinted at in all presentations, I just want to underscore this. So
Yeah, I would say, from the practitioner of just, how do you implement something new, right? The challenge for us, like just starting out, is just operational, right? How do you use a new banking product for a population that is underbanked or unbanked, right? And that's directly related to one of the longer term goals of the program, which is like, access to opportunity, right? Which Madeline and Caroline talked a lot about, but also it being a pathway to financial inclusion, right? And this idea of using mainstream, more, banking products can be that. So I think, we amongst a few other cities that you saw, Molly, on your list, right? City of Oakland, Stockton, Portland, are using prepaid debit cards, essentially banking products that have been around forever, for mobility wallets. And that is a new type of use for the cards, right? Limiting them to the 8 merchant category codes, making sure that actually functions. The cards work well. They work for 12 months, right? A lot of times these prepaid debit cards really are meant for a month or 2 months, right? They're meant for rewards. And that's most of the card programs that are out there, and the vendors are mostly kind of working with business as a rewards program and aren't really set up for this type of, for the customer service support, right, that we're learning we need, but also for like the type of just functionality that the cards really need to be used. So those are, things that we're learning. We're going to do a phase 2. We learned a lot of lessons learned, right? Like sometimes cards didn't work. Sometimes customer service wasn't where it needs to be. And we're going to be doing enhanced kind of outreach, enhanced educational materials. We're actually been talking to banking partners to actually come in and do financial inclusion as part of our workshops that we're doing as part of the sign up and outreach process. So I think it's really just trying something new, a new banking product. It's trying something new is always hard, but I would say that one of the keys is scaling, right? We did a phase one. We didn't do all of the 2,000 wallets that we had in one go because we knew we were going to have lots of bumps in the road, right? We knew we were going to mess up and we were going to have successes and failures, and then we were going to need to learn from those and iterate.
Absolutely. Actually, so I think my next question is about scaling, but I'm going to wrap in some comments I see from in the chat, in the Q&A box as well, regarding costs. So when we talk about scaling and we talked about costs of the programmatic costs that it costs to deliver this kind of mobility wallet, what are some considerations for scalability that, that we can, I mean, of course, it's not cheap to administer these programs, but also, when we think about the next phase of the mobility wallet and scaling it to the county and beyond, what are the considerations there? Anyone want to speak to that? I'll turn it to Avital first, and then maybe our panelists could chime in.
Yeah, I think you're kind of talking about this question. There's Paul Burke in the chat is asking about cost per ride, and in terms of the category of like paratransit, taxis, and ride-hailing services, I would say the lion's share, maybe a handful of those rides, and happy to share that the breakdown of those. A handful of the rides are taxi and access services, right? For people who have access services, right? And the access services rides, individuals pay like a portion of that cost, and then actually Metro and access services pay the rest. So that's kind of an outlier. I would say the majority of rides were on Uber and Lyft that we saw. The average cost that Metro was paying for those rides, right? The cost out of the mobility wallet was an average of $20 a ride, which generally is actually a cheap ride hailing service. We think, we don't know how many miles people were riding, but we think that it was probably short local trips or rides to transit, because a $20 ride for Uber or Lyft is probably somewhere in the 5 mile or less kind of category. That's just kind of on average, but doing some more research onto that. So there was a question about, are we working with ride hailing companies? And we aren't yet, but we've been talking with them through this, before the pilot and through this pilot, and we're looking to how we can work with them to get more robust data. They are not interested in subsidizing the rides more than we had before, but they do have programs in which we could potentially get more robust data on trips, right? So that we can understand where people are riding and maybe kind of use that to inform transportation systems in the future. Is that kind of what we're looking for in terms of cost? Anybody, Madeline or Caroline, you want to kind of add in terms of cost?
No, I think for me, you got it. Thanks.
Great. So I think maybe to conclude our session, we'll take a question that is about basically how do we think about the social fare discounts for unemployed low-income programs. And I guess the question I want to broaden that to think about how do we think about the mobility wallet in the context of other social service needs. This could include healthcare and other options. So how do we think about the mobility wallet in the context of the other social service needs that the community may be trying to meet with other types of programs, or how do we synergize these?
Yeah, I mean, I think I'll just speak to that. It's interesting to see how many people that are receiving the mobility wallets, like their kind of participation in these other programs. And the interesting thing is that while, like, for example, everyone in the mobility wallet is eligible for fare subsidy, the LIFE program, not everyone is actually signed up. Similarly, like a lot of those people are probably eligible for a variety of other public benefits, but there's even less adoption of that. So I think part of the opportunity is to think about how enrolling people in transportation support can be a pathway to having them understand other different opportunities. And then I think maybe Avital could speak to this, but we might run out of time today. But how can LA Metro and other county kind of social service providers get together? And I think those conversations are in process about, how does the mobility wallet make your food stamp, make your Medi-Cal benefit go further and really be be it, because we know that if you if you're receiving some of these benefits, you probably also need transportation support. And so, your food stamps and your food support might go further if you can go to a grocery store that's maybe full service and you can actually have the opportunity to pay for that. So I think there's a lot of synergies, and hopefully Mobility
Absolutely.
Wallet will be an opportunity for social service providers and people like public insurance providers to actually start to kind of get together and think about kind of synergies and partnerships going forward.
Thank you for that, Madeline. And unfortunately there, we'll have to cut it off because we're at time, but this was such a fantastic panel. I really learned a lot. I'll turn it over to Laura Podolsky to close us out.
Yeah, thank you, Molly. Thank you, our speakers and panelists. Please visit us at our website, ucits.org, where you can find more information about our research and upcoming events. We'd also really appreciate if you take a couple minutes, tell us what you thought of today's webinar by participating in a very short evaluation survey that Ali Soto will be dropping into the chat box. And I just want to close with gratitude. Thank you so much, Avital, for joining us today as our guest speaker and commentary, providing that commentary. I want to thank our speakers today, Caroline, Madeline. Thank you so much for your research and sharing your insights with us. And thank you to Molly for putting this all together. It was really a fascinating panel. I just want to thank you so much for your hard work in pulling that together. And of course, our behind the scenes webinar specialist, Alejandra Soto, who just made sure everyone had a great experience today. And thank you all for spending your time with us. So with that, I'll conclude today's webinar, and I hope everyone has a great rest of the day. Thank you so much.
Thank you.
Thank you.